Hi, I'm Ian Bradford. I'm a colorectal and general surgeon. I've given up a large chunk of my career and my time looking after problems in the female pelvis or the male pelvis, whether it be from disease in that area or from the pelvic floor itself. Now, a lot of people talk about the pelvic floor, but actually a lot of people don't know an awful lot of detail about the pelvic floor. And there's some key differences to that normal floor concept of a home or a building. Firstly, it's not hard, and secondly, it's not flat. I have a model here of a pelvic floor. If you look into it, you can see that the pelvis floor is made of muscle. So it's stretchable and it's contractible, and in fact, unfortunately, sometimes it deteriorates. You can also see that it's quite curved from left to right, maybe from front to back. And it's actually a whole sheet of different muscles all made up together to collectively be called the pelvic floor. And they run from the tailbone around at the back, all the way to the pubic bone at the front, and from one hip bone across to the other. So it's curved in multiple planes, and it's more like the saucer of a tea set. Now, when problems arise in that pelvic floor, or there's disease in the pelvic organs nearby, you can imagine that a number of different specialities need to come together to try and sort out the problems. In other words, we share territorial space with one another. So us bowel surgeons and some of the gynecologists and urologists, they all deal with problems down here in the pelvis and the pelvic floor. Physiotherapists may be involved as well. Now, there are three key organ systems in the pelvis. One is the urology system of the bladder and the urethra. Second problem is that of reproductive organs, so the vagina and the cervix and the uterus. And then there's, of course, my patch, which is the bowel, and that's the rectum and the anus. Now, patients often present to us with a complex number of different components, all affecting one or more of those compartments. And because there's just one patient, you, there's no point in us each separately approaching the problem. It's far better to work collaboratively and use our collective perspectives and collective experience and wisdom and knowledge to bring about the best results for you. And that's why I'm very involved in helping to run a pelvic floor MDM meeting. That means a multidisciplinary meeting where there are radiologists, physiotherapists, gynecologists, urologists, and other bowel surgeons like me. And we sit down around a table, we share ideas, look at the pictures, hear your story, and try and put it all together and offer you the best contemporary advice from around the world. So if your pelvic floor isn't feeling like steak, well, there's a lot of good living and good function that's at stake. So don't delay. If you're having problems, particularly if you're having problems with the digestive system component or the pelvic floor, get in touch with me. My door's always open. I'm very happy to have a chat with you.